How do you talk to kids about death and loss? And how do you help a child who's experienced the death of a loved one, especially if you yourself are grieving? Our experts answer these questions and share ideas on helping children cope with grief. Next on Speak Your Mind. Welcome to Speak Your Mind. I'm Dr. Carloyn Phelps, licensed psychologist with the Human Development Center. Dealing with the death of a loved one is difficult for adults, so imagine how a child must feel. Tonight, our guests share their expertise and provide advice about helping children with grief. If you have a question on tonight's topic, call the numbers on your screen right now. Locally, dial 218-788-2844 or call toll-free at 1-877-307-8762. And you can also text us your questions or email them using the number or address listed at the bottom of your screen. And we'll be taking your questions during our entire show. Now, you've had 2 weeks off, you've had plenty of time to rest, so it's time to get back to work. We do hope you had a good Thanksgiving, though. Let's begin by introducing our guest. Gina Dixon is a grief therapist at Essentia Health St. Mary's Grief Support Services, where she helps kids and families adjust to life-threatening illness, traumatic loss, and death. And Sabrina Matheny specializes in the treatment of trauma and is the supervisor of the Trauma Assessment and Family Treatment Program at the Human Development Center. Thanks to both of you for being here tonight. And this is such a big topic. When I was thinking about good questions to ask, I came up with 18, some with subparts. We're not going to get to all of those, and besides, we have to get to some of your questions too. And so really, I think this is like our introductory show that we're doing on children and grieving, because we could talk for 2 hours and we aren't going to be here for 2 hours. But I thought a nice place to start would be, since the answers to all questions kind of depends on how old the child is, how does the grief process look differently in children of different ages? And maybe we'll talk a little bit about one age and then go on to the next age. And Gina, we'll start with you.
Sure. Well, you know, if we're starting with children as young as infants and toddlers.
Yeah, let's sort of go to
Sure.
the 0 to 2 or 3.
Right. You know, sometimes people will wonder, you know, is my child even able to grieve? And the truth is, if a child is old enough to love and attached to someone, they're old enough to experience grief. And so very young children experience the death of a loved one as an absence. And, you know, the way that young children express distress is often by regressing or irritability. Sometimes very young children might become very anxious about separating from a primary caregiver. And young children are also very responsive to, you know, the emotional temperature in the room, as it were, of how other people are experiencing the loss too. And so, you know, one of the important pieces to remember with young children is just extra comfort care. You know, they might be very clingy or very anxious, and so just to be able to maintain some of those comfort routines can really help young children.
And so in that 0 to 2 to 3 age range, are you talking to kids that young, infants? Are you saying the words to them about maybe, you know, daddy died or mommy died? Or how are you, you know, if they're not even verbal yet, do you say things to them? How does that work?
I think you absolutely do start to say those words, or, you know, even I'm sad that daddy died, or that daddy isn't here, or you look sad. Because that label of emotions is part of what we do just in general with really young children, to start to give them that vocabulary. And so when they have that confusing absence, to kind of label that for them, and to help them develop the language that later might be an important part of their development.
And so that you're really then, with kids who may not be able to understand the concept so much, but you're introducing the topic and laying the foundation then for a broader discussion, certainly later on, and maybe even giving the message that it's okay to say these things, that daddy died or mommy died or.
Exactly. And then, you know, as children move into those preschool years, obviously they begin to have more words, more language to describe their experience, and yet they're still not understanding the permanence of death until closer to 5 or 6 years old. And so, because young children are very egocentric, they may create explanations of why the person left, especially when euphemisms are used, like daddy's gone rather than daddy died. And so it's really helpful to have that concrete language in giving explanations that we build on as they grow in their understanding.
And so euphemisms are not really helpful then.
Exactly. I think adults oftentimes are uncomfortable with the topics of death and grief. And so one of the things adults do is we develop all these euphemisms like moving on, passed away, gone. And for children, those are really concepts that they have no way of understanding. They're so vague. They're not really tied to anything that they can relate to in their environment. So being more concrete about, you know, daddy died, daddy's gone and not coming back, you know, their body stopped working. Those things are much more meaningful and help kids create an understanding rather than just adding sometimes to the confusion when we use language that might be adult language but is hard for kids to understand.
Well, and daddy's gone when daddy's at work, daddy's gone when daddy's hunting or at the hockey game, and so daddy's gone and never coming back doesn't make much sense, but daddy died and is never coming back. Where I really like that the body stopped working, because there's it's concrete and factual without it being euphemistic then.
And there's just many wonderful children's books that gently have conversations about those concepts and help children to be able to have conversations with a caregiver in the context of story time and reading someone else's story. Sesame Street has some wonderful materials, and there are just books for children as young as 2 or 3 to discuss really complicated subjects like miscarriage or suicide or some other things that are hard even for us as adults to talk about. And so those can be wonderful tools for adults to bridge those conversations.
And I want to come back to that I want to come back to suicide, and when you start talking with kids about suicide and a little bit, and you've actually brought some books here, and some of them are for younger kids to show us from your library at the Grief Support Center. That are available for people to check out.
Absolutely. And you know, that's something that, you know, public libraries have wonderful materials. We also do. And you know, for people who are looking for something, even you know, the Arthur series, When Dinosaurs Die, is a great resource that I think is light enough that it makes that conversation a bit safer for parents and children to have together, or teachers, or, you know, other care providers.
And you know, even I want to read the book When Dinosaurs Die now, and I know how to talk a little bit about death, but I haven't talked about dinosaurs dying, so that would be a book that you could easily, I think, read with a child. So now when you get to school age, 7 through 10 years old, 7 through 9 years old, Sabrina, how does the grieving process look a little different there?
Well, I think, like Gina said, you have kids who now start to get the idea of the permanence of death. They're still a little bit in that egocentric world where, you know, they're most likely to interpret things as somehow being their fault. We can see some of that regression in terms of not being able or not doing things that they used to be able to do. And sometimes a lot of clinginess or a lot more kind of moodiness than what the child may have experienced before the loss.
And kids at that age also have friends who they deal with, and then are in the position maybe of returning to school and kids asking them questions. And how do you prepare your child for handling those questions at school?
Well, exactly. and you have a conversation and you talk about that. Have you thought about what you might say if someone asks why you've been away from school? And I think always to open up the question, because they may have a ready answer that's really comfortable for them, rather than, you know, filling in some script that isn't going to work. But if they're stuck on that, to be able to talk about that a little bit, and also encourage safety zones where if something becomes difficult, that they know that there's a safe person at school they can go and talk with, whether it's their teacher or a school counselor or someone, if they just become overwhelmed in at any point, either early on or later, because you know, kids have short sadness spans. We've all seen it where they are showing up at a funeral and they're not really crying and they're laughing and playing with someone, and then the next moment they're really irritable or they're really sad. And so to put supports in place for the long haul, I think, is really important.
I think sometimes we also talk with parents about having a conversation with the teacher.
Absolutely.
Yes.
About how the family kind of wants to discuss with the classroom, and what the teacher can do to talk with their students about what, you know, the loss that the child who may be returning to school has had.
I think that's a wonderful suggestion, and because the teacher can have that pre-conversation with the students of this is what's happened to Susie, and also maybe help those kids say things like, it's okay to ask questions, or they don't want you to ask questions, or whatever's going to be helpful at the time. And I think, you know, you brought up a point, Gina, that's so wonderful, that whole notion of a child at a funeral or a child at the lunch afterwards wanting to then go out and play, which is so different from the adult experience, right? And so one of the important things for us as adults is to remember how different kids are in their emotional worlds and how long they stay with any one emotion, which is so different from our own personal experience.
Yeah,
then.
exactly. To normalize that for parents and teachers and other caregivers, that's a natural way that kids dose their feelings so it doesn't become too intense and overwhelming, and that's healthy and it's natural.
Now we get into middle school and high school. What's the child grief experience like for those teenage years?
I think it gets a little more complicated in the teenage years, like a lot of things do with kids, because you might have kids who start to have kind of a lot of their own worry and are able to ask some of those larger esoteric questions that, you know, what happens after we die, you know, kind of start to think a little bit about their own death or the kind of the death of other people that are close to them. And so you might see some anxiety related to that. You might see kids who are really kind of trying to avoid, and they just kind of go a little bit more maybe to the extreme of things they did ahead of time, like spending more time with their friends, or I think trying to not kind of be as comfortable with those feelings and doing whatever they can do to avoid.
And is that an okay thing? Letting teenagers just go be more with their friends? I could certainly see that if a parent was in the middle of their own grief, it would be easier just for the teenager to go be with their friends, or some might want them closer. But is there a right or wrong answer here, Gina?
Oh, it is a complicated question, isn't it? And I really encourage parents to reconnect with their kids. That adolescence is a time of separation, and it is natural, even for teens that aren't grieving, to pull away some. But I think it's an especially important time when kids are grieving to check in. And to, you know, monitor, are they withdrawing from their friends, which sometimes happens when they feel like it's not okay to be out with their friends because I'm feeling so sad and I'm feeling like I'm the only one who's ever experienced something like this. And especially for teenagers, I think support groups can be such a valuable experience because they do relate well to one another, and to be able to share those experiences with other young people their age and talk about positive coping to reduce the risk of numbing out through drugs and alcohol, or, you know, other ways that kids might seek to, you know, numb that pain.
So maybe kind of corralling the teenager You know, like at least once a week we have to have dinner together as a family might be one way of, yes, you can go with your friends. Kind of, I encourage parents to do that with teenagers no matter what. But what we're saying now is we wouldn't do less of that during a crisis.
And I think sometimes it is identifying with a child, what is the way of connecting with your parent that you like? And maybe it's just going for a walk. And we're going to go for a walk once a week, or if you're sad, rather than telling me you're sad, that you can just say, hey, can we go for a walk? So trying to identify what's the activity that's a connection that may not be kind of grief-focused, but might be something that is maybe a positive experience that does have that time together to balance some of that interaction with friends versus connecting with family.
And we don't want all of the parents and child's interactions to be grief-focused either, right?
We're still a family. It's still okay to celebrate who we are and to do things that are fun. And even though we may be feeling really sad, talking about it isn't the only way to express that sadness. And I think just even kids of any age being able to, rather than sit down, tell me how you feel, to be able to have a conversation while you're shooting basketball hoops or playing with Legos or doing something that diffuses some of that intensity that comes from face-to-face conversations can be a really smart way to go about that.
Here's a question from a woman from Cloquet. Is the belief of a supreme being or God important when discussing death with a child, Sabrina?
Well, I think it depends on what the family's belief system is. And I think when you start with the idea that we mentioned earlier about, you know, your body stopped working, that then allows you to go into whatever those spiritual contexts that the family has. I think one of the things that's important if you are going to talk in that spiritual way is that that you're again tailoring your conversation to the developmental age of the child. And so trying to be as concrete, I think in some ways being honest about, you know, I don't know. So I think it's something that is important to a lot of families, and I think it can be a really comforting and positive experience to talk about with the child. But I think, again, it has to kind of go back to what the child's developmental level is.
And at what point should we even begin talking with kids about death? You know, certainly I think when somebody dies, or if they're in the position of having a life-threatening, if there's a person with a life-threatening illness in the family, that naturally brings it up. But we are still a society that is so death avoidant.
Yes.
Talking about that. And so if we were to launch a preemptive strike, what's the advice for families of when and how do we start talking about death?
Well, I can give an example from my own family. When my oldest son was in preschool, he was outside on a playground one day. The lawnmower had come through and ran over a frog, and all the children were pointing at the frog saying, "What's the matter with that frog?" And the very uncomfortable preschool teacher said, "Oh, nothing, it's just sleeping." That was a teachable moment for me as a parent to talk about that afterwards. And what's funny about this story was my son, when she said, "It's just sleeping," he said, "Well, if it's just sleeping, why is its leg over there?" You know, he wasn't buying it. So I think kids are naturally curious about dead plants, dead animals, and so to have those teachable moments that occur in a non-threatening, non-anxiety producing kind of way, and we build on those.
And you know, what I liked about what your son did was he illustrated so well what great lie detectors children are, and that's when these saying things to help kids that aren't true just leads to more questions that you now have to answer, like what's the leg doing over there, right?
I think sometimes adults project their own anxiety about death onto kids, particularly young kids. It's like they're naturally inquisitive, and they just want answers that are kind of at an appropriate level for them. And I think sometimes adults, out of their own anxiety, feel like they have to have kind of a grand answer, or they have to protect the kids. And I don't necessarily think that that's helpful, like the frog example.
So using the teachable moments of nature, which we know kids encounter all the time. And would you suggest then that introduces the topic of death of non-humans, and what the next step would be introducing the notion that humans can die too?
Correct.
And how do you do that?
Well, very often kids bring up the subject themselves, and they will say, "Could you die, Mommy?" Or "Could you?" I mean, that's a very common question for young children to ask. And so, gentle honesty when those conversations happen. Or if there are people known to your child, a neighbor or someone who has died, to provide them opportunities to attend rituals, to pay respect to someone who has died, and prepare them for those experiences, to offer options, to participate in rituals that can help build then and prepare the way for later losses of someone who's more significant and close in their lives.
And so telling the truth, but we don't want to scare kids.
Right.
And so when a child says, Sabrina, well, Mommy, can you die too?
Right.
Now, how do we answer that without then scaring the child into thinking Mom's going to die any minute here?
Right. And I think that's about saying, yeah, kind of all people die, and Mommy's healthy and taking care of herself, and I hope, I want to be here for a really long time with you. And so I'm not planning on going anywhere. Those types of, I think, responses.
And so kids get easily diverted and will accept that as an answer. And I think that's what adults are afraid of, is that they won't accept that as an answer.
And I certainly experienced that at some point along the way with my children. And part of that reassurance is, I'm in good health. I go see my doctor every year, and I plan on living a long time and bouncing, my grandchildren on my knee. But I can't promise that I'm never going to die, but I can promise I'll always be honest with you, and I can promise you that you'll always be taken care of. And so their follow-up question was, well, if something happened to you, who would that be? And, then having that conversation, and they kind of laughed about it and talked about their uncle's drum sets, and, it wasn't as terrifying for them as that fear of the unknown, that I wasn't afraid of talking about it.
Here's a question from Hayward, Wisconsin. A woman in Hayward writes in that teenage children just lost an uncle to a rare form of cancer, and now the aunt has a diagnosis of cancer. How do you talk with the children about the differences? That notion of, oh my gosh, is everybody who have cancer going to die equally likely to die?
Right. I think those situations get to be really tricky because people generalize and children generalize, and so I think it is being as honest and as factual as you can, which is almost a theme.
It is a theme.
About here's the cancer your uncle had, and this is kind of what it does, and here's what your aunt has, and here's she's going to do treatment, and here's what we know, and we can't really predict the future, but we're going to do everything, or she's going to do everything she can to stay healthy for as long as she can.
I said that I wanted to get back to the suicide question, and we're talking about being factual here. When a family member has suicided, what do we tell kids? Now, I can imagine telling teenagers the truth, and what do we tell younger kids, and how much and when?
I think even very young children deserve to hear the truth, especially if it's someone close to them, because what can happen is if they're told untruths, they may hear it in a less supportive manner on the playground somewhere else, and so to be able to prepare them. And I think the idea of destigmatizing suicide by talking about it as a brain sickness, and that most people who have a brain sickness like depression, get medicine, can get better, but sometimes people are so very sick and so very confused that they do things to hurt their own body, and then they died. And so, that gentle honesty of, the person loved you very much, but they were very confused because they were so ill. is a gentle way of having that conversation. And again, there are some wonderful children's books and some wonderful websites. Save.org is one that I would recommend for families in that situation.
What a beautiful way you just described it. And it is that notion again and again of if you don't tell the truth, that's going to be more hurtful to the child, and the child's going to hear the truth somewhere. I liked what you said about you want them to hear it in a supportive context.
Right. And I think misinformation breeds anxiety in kids, or information that doesn't quite make sense to them contributes to anxiety.
And it is that notion that they can often be far smarter than and know things and sense things than we often give them credit for. We are out of time. That's how quick this goes. Still, after 2 weeks, it still goes quickly. So if you didn't get a sense of it, what is the take-home message? The take-home message is what your mother always told you, which is tell the truth. It's still good advice. She was right about that. She might not have been right about everything, but she was right about that. Kids can handle it, and you can handle it too. And I think the other take-home message that you heard very clearly from our wonderful guest tonight was start talking about death in your family early and use those teachable moments, not just when there is an imminent reason to use those. So we thank our guests for being here, and we thank you for being here tonight with us as well. Don't forget to visit us on the web at speakyourmindonline.org, where you can find a schedule of our topics and resource links, and read my blog, the place where I answer more of your questions. And you can also email us your questions about next week's show, when we'll have tips for parents dealing with toddler tantrums and meltdowns. That's the small toddlers, not the teenage toddlers. I'm Dr. Carloyn Phelps. Thanks for watching, and good night.